for you. Since there have not been any big spikes or increases in COVID deaths or case, I guess locally, this is a specific question. What phase of opening are we in? The last time you were here, you said we were at halftime.
Yeah, we're at halftime, Walt. I mentioned that too. I said we're on the downside of that. It looks like we probably, health experts have said that we're probably on the downside of that, so the backside. So now we just have to hunker down and continue what we're doing, practicing good social distancing and all the other things I've talked about. But yeah, so it looks like we've seen that we have fewer cases, fewer deaths, of course. But again, we're still may be lagging behind the number of people who tested positive specifically. So really, bottom line, we're not out of the woods yet. It's going to still take some time. All those efforts we've done at the beginning of this pandemic, we have to continue to do much later. And I think that people have to really focus on adhering to social distancing and doing all those things for a longer period of time.
Next question for you, Dr. Tom. When people are out shopping, pharmacy, grocery store, gloves. I mean, masks for sure now, but what about gloves?
Well, you know, as you've heard me say this before, answer that question. I think that gloves give people a false sense of security, and they are something that can help spread germs because people aren't washing their gloves. So when you're going to the grocery store, it's better off that you just have your hands bare, so you handle what you handle. You're not putting any new germs. But then after you get home, as you clean, sanitize your surfaces, the bags and everything else, that you wash your hands. Because gloves, people who are wearing gloves, they're just transferring all these germs all around with a false sense of security. I've yet to see anybody washing their gloves. So again, until that happens, you know, that I think people should not be having to wear those. Gloves are going to be when you're direct contact with a COVID-19 person. That's where there's that protection. Think about this. If you're wearing gloves, you should have a mask and the full garment if you're trying to really protect yourself.
Okay. And 2-3 weeks ago, masks were, you know, there was this transition because there was a shortage of N95s. What do you think about people being required to wear masks? Because even now when it's more prevalent and we're kind of been told to do so, it's 50-50 in the store.
Yeah, I tell you, it should be 100%. Remember, if I'm wearing a mask, it protects you all. You wear one, it protects me. So if we're both wearing them, we're protecting each other. So I think that the mask wearing is going to be something that may be part of our social norm in the sense that if you have some symptoms or not feeling ill, maybe you just have a cold or flu, you should have a mask to protect the other person and vice versa. So the facial coverings are probably still a very good, important public health thing to do. Mm-hmm. So I think it's prudent that everybody who's going in a store and they're doing their essential trips should have masks on. I think the exception would be if you're out running and you're out social distancing. Of course, it's hard to run with a mask, right? So those things, I think that there should be some exclusion or a relaxation of that. But when you're talking about going in and out of business right now, where we're in, until we're totally out of the clear, that may be something that we have to start getting used to with facial coverings.
Yeah, the masks was kind of an updated moving target, and now we're being told of new symptoms. This is the next text coming in. Yeah. Why is this? What are we finding out with people who have symptoms that we didn't know about before?
Well, I put it this way very simply. We had the basic of fever, cough, shortness of breath. But then when you have 1 million cases of people who had COVID-19 and you take a history and what they had, a lot of them had a lot of variety of symptoms. So what you're seeing, this addition of these symptoms are just addition of symptoms that happen in COVID-19 patients. But the core is what we know, where the damage happens in the lungs, is going to be shortness of breath, it's going to be fever, and those are the core symptoms.
Dr. Tom Hopkins in Roseville. Tom, thanks again. A lot of good answers, a lot of good questions. We thank you all for texting in, and we do appreciate it. Tom, thanks. We'll visit again soon.
Good to be here, Paul.
Likewise. Okay.